Hello. Thank you. There's an awful lot of you. That's not scary. So thank you very much. Thank you, first of all, to Ronan and the team for inviting me to come here. I'm exceptionally excited to be here. Thanks to Paddy for such a lovely introduction. Means I don't have to tell you anything about myself. Might start with just kind of to get a sense check in the room, from what I could see, of design and people's understanding of design. So it's hands up time. So of everybody here, could you put your hand up? Oh, thank you, that's helpful. Could you put your hand up if you've worked directly with somebody who is a designer? Ooh, oh, that's good. Okay, so keep your hands up if it's somebody who's been as part of a structured project, a structured healthcare project in healthcare design. Okay, that's good. Anybody who's worked on an innovation project? Okay. And what about an improvement project? We all love the improvement projects. Okay. And so anyone who's just excited to be here, like me. Yay! There we go. Right. So this is when people think of design. So this is currently in the V&A. There's a food exhibition on, and this is some of an image from it. But when people think of design, they often think of physical objects. They think of how something looks, the way something making something pretty, and that is design. But design is a vast space. So if you go to the dictionary version, it's considered a plan or a drawing, and it's also a decorative pattern. But if we look at the third point, it's the purpose of planning that exists behind an action, fact, or object. Okay? So this doesn't help the design community to describe what they do when it is this broad. What I'm hoping by the end of this, in 27 minutes and 42 seconds, that you guys will have an understanding of how design might positively impact your work in healthcare. And instead of this being a session of like, ooh, I'd love to inspire interesting conversations, I want action from this. And so everybody here has the power to shift their mindset, which would possibly happen over the next 2 days anyway, but shift your mindset and how you see design and how design could be used in healthcare and what you can do, because we can all do things. So I like this definition of design. So the Design Council in the UK, which covers all types of design, talks about how it has many different definitions, but at its heart, it's about the process of translating ideas into reality. So it's making things tangible and concrete. And there's nothing more tangible or real than being on the receiving end of clinical care. So this is effectively the process by which I see design, and I'll just go through these briefly, and then we can talk later. And I'm around for the full conference as well if anybody wants to discuss these at any stage. So if we start with empathize, research, and understand. We had very helpful the whole talk about empathy and kindness and understanding. This is a process this is a structure that you can use for anything, but you can also use it within a healthcare setting. So the empathy isn't one-sided. So it's not the doctor or the designer looking and having empathy for the patient in a binary fashion. It's about understanding everybody who's in as part of the mix. So that will be everybody involved in the process, all workers, everybody within the patient scenario, which would include patients and families. This is also about getting to grips with the data. So you'll have the data and the analytics behind it. That leads you to a position to be able to define the problem. And this is the key thing. There are so many times that we have improvement or innovation or whatever blingy projects going on, and actually everybody has a different definition of what the problem is. And then ideate, you gather together, use methodologies, and these are all structured methodologies as to how you figure and get ideas, prototype around those ideas, and then test and iterate. And the key thing here is that It doesn't stop at test and iterate release. You have to do it again and again. So design is a living concept. We can't just do it once and then be done. And this is where this is difficult with budget constraints, because as you get budget constraints, you don't get a budget constraint that will, you don't get a budget that will allow you to go on infinitely. But doing something once and then stopping is never ideal. So there's often people talk about, so we heard earlier on about patient focus, and it can't just be patient focus, we have to understand the different bits. But there's often a true driver for a project, and so something will be like a patient group will create a political will, which will create funding for something to be done, and then it's done with a patient focus. Data or metrics. I'm based in London. There's a lot of the NHS requirements for meeting specific metrics, so we'll get data to see something. Design thinking or a design approach is about bringing all of this together. So you bring all the people together and all the information together. And this is where it often is very hard, because we deal in complex areas and people will run away. But you can't, success will only happen if it meets the needs in all these places. And there will be conflicts, and you have to resolve each of those conflicts. So this is kind of my version of well, it's not mine. It's quite common, a version of it. So you can think of design as falling into each of these areas. So we have information design, which is a lot of the communications that people would have. So either information leaflets, websites, etc. Products, as in physical things. Service, which is where this is where the people come into it, and so something it will have a service with components and different people part of it, and then organization, and in healthcare that's our hospital systems, trusts in the UK, and then the overall system, which is effectively the government, the national bodies that do things. So we have a problem in healthcare. All other industries, most other industries, are able to do things across all these levels. We currently have a problem whereby we are stuck somewhere around product and service. So the fanciest, funnest things, the watches that magically save your lives, they're all in product space. They're not services. And I'll talk a little bit about that. But my space is service and organization, and then sometimes system as well, which is kind of the policy impact of it. The key is that a patient feels all of these all at the same time. So the patient experience is not a binary thing. They will feel the impact of all of these. So if there is a national cut in funding, which happens at a system level, it will impact the services at an organization level, which then reduce the services, and then we have physical products or procedures that you'll have related to it. I think a design mindset, which is about bringing in together all that complexity, bringing all the people in together and figuring it out, can positively impact any of these levels. So there is already a drive in products that it is based on clinical need, but it's much easier to have an app, test it with people, and then iterate on it. But I'd like us to bring it better. So service design specifically is a hybrid approach, which is about experiences. It borrows from product and industrial design, but also sociology and business strategy. And so this is another design council in the UK definition. But as doctors, once things like sociology and business strategy come in, it's like, oh gosh. But these are the key things that we need to understand and we need to engage with to catch up with other industries. Or try to catch up with other industries. So I think I kind of describe design thinking or design approach as being a bit like one of these mixing tables, but instead of, how many is that, 8? Instead of those 8, it's like 50. And you move one, and one of the others will move. Unfortunately, as you move one, it can be very hard to predict which other ones will move. So, an example of this would be virtual consultations. Yay, patients stay at home and it's much more comfortable and we connect via Skype, etc., etc. But then one of the impacts of that was a push-up in diagnostics. So it's not a skill set. They don't teach you how to do virtual consultation in a medical school. So it's not a skill set that that a lot of people have. So then therefore, in order to do it, you then push up the diagnostics. So studies from some of the original virtual consultations that were done in Mayo showed the push up in diagnostics. So your perception of saving one place isn't necessarily such a saving. But through methodologies in terms of design thinking, you can start to make sure that all those 50 levers, that you're watching them all, so that when one moves, you can see the other ones that move. Now, for most designers, working in healthcare feels like this. And so, as part of this, I interviewed some designers who are specifically healthcare designers. It's pretty hard to get them, because this is our world, and this is how they feel about our world. And I think part of the job of everyone in the room is about how we communicate what we're doing, and help to translate it, because it's like this kind of thing. For a lot of people, they wonder, where do you even start? So, totally differently. Yes, this is a photo of sinks. So scrap everything I've been saying for a moment and just think of sinks. So I'm in airports more than I should be, and this one was Dublin Airport. Have you ever noticed and the toilets here actually have obliged me with giving a live demonstration, the way that so often they just look out trashed. So what you'll have situations where there'll be soap falling off at the wrong time because it's a timer soap, and you'll have water between the sinks. You'll have the water on the floor is a classic. Or you'll have to put up signs because actually the way that it's been plumbed, the water's too hot and it's dangerous. So what relevance is any of this? We might do a hands up. Anybody have ever washed their hands? Ever? Yay! There we go. So the people who are involved in this process, and not meaning to judge bathroom sink designers or interior designers involved in it, they have all washed their hands. Everybody there knows what it's like to wash their hands. And they still make these huge mistakes, and they're left there, and the classic one of the soap dispenser doesn't work, and so they put in a soap dispenser beside it. The workaround. These things happen in what would be seen as something that is very, very familiar. These designers involved in this process, the engineers, should know what this is like. So then you come back to our world, whereby we're doing it in a space where there are very few dedicated healthcare designers, and people who do service design specifically for healthcare, and we don't have time to communicate to them the reality of what's needed often. And so you end up with a situation whereby things can be disastrous and go very badly wrong. But you only notice design when it's bad. You notice a bad experience when something is a design flaw. So here's just this is my therapy session. This is a lovely one, common enough. Tea bags, you're supposed to put the tea bag in the bin. Anybody take a tea bag out of a cup? Bin not appropriate. This is another one. Again, in Heathrow Airport, they try to get you to take the lift, but then there's always a queue for a lift, so then it's actually not that faster. They're communicating this thing, it's a lie. One of the things, again, airport time, one of the things that was really interesting is that for planning for Heathrow Terminal 5, they did analytics. So they did spotter analytics, so you can see everybody going everywhere, as to how much they use the bathroom. And so that was great, and so the data told them their numbers, they could plan for Terminal 5, happy days. What they then did is they added in designers to talk to people-to-people basis, alien concept, and they found out that actually people who were hard of hearing were going into the toilets to hear the announcements because the common areas were too loud. It's these sort of things that the data definitely doesn't always have all the answers. And in the technology, this is a sensor, again, beating up Heathrow. This is a sensor, and so it's fancy, and it tells you how much you can use the sensor, and it'll guess where your water is, and will pour it out. That's great, happy days. Unfortunately, the sensor doesn't work very well, so more often than not, you get that. And the problem is that there's a reality that this works fine. So we have a lot of this in healthcare, whereby the people who are involved in the design process don't actually understand it enough. And we've got fancy sensor things that are not working, when in fact, that's all we needed. And that's, again, part of good design. A few little things. These are always, everybody has these at the bottom. The problem in healthcare is that a lot of the things that work for every other industry don't work for us. And there are points when the automatic response isn't necessarily great. So this was the options I got for an email, which was a response to my thoughts on this. You can laugh, it's okay. But we have a situation whereby somebody was told via video link that they were going to die and they passed away the next day. This is a failure, it's not a failure of the doctor. This is a failure of the system that put that in place, that put it in place as a product and not as a system. It should be an integrated service. You need to train people if you're going to give them a new technology. You wouldn't throw them into an operating room and give them a new type of stent to use and not teach them how to use it. We're not teaching people how to communicate with new means. One thing that does really annoy me is that I talked to the lead designer for the NHS, and he was talking about design light, which is that design thinking is very popular. There's lots of people who go around talking about it, and so we have a version of it whereby it's like token design. So we all come off our busy schedules, go into a room, fill in post-its, come up with the magic idea, and then that magic idea falls on its face. And it's because it's not being done properly. So it's not a comprehensive solution. It's just something that's being put together. And unfortunately, that's giving design as a concept a bad name. This isn't good enough in healthcare. We don't ask anyway, but this isn't good enough. And one thing we are doing is we're trying to optimize a system that is fundamentally broken. And this was another designer who was saying this, is that the resources and constraints is such that that we're just trying to tweak something that we shouldn't be tweaking. We need to go back to fundamentals. And where the magic pot of money is to do that, I haven't found yet. But so this is, I love this. This is a product, right? So this is a thing. Everybody know the Good Sam app? If you don't, look it up, it's amazing. With an app which connects the people, you then have a service. I'd love to have a long list of a whole load of great design things to show you, but I don't. But there are glimmers of hope, and this is definitely one of them. Another similar one, so blood pressure all up in the air, terrible, from this week. So this was very funny. Irish Heart Foundation, I loved it. In Grand Canal Dock, they had like a chair and they had danger around it. And this is smart and this is intelligent and this is communicating to people. So if we look at our levels, this is at the information level of design. So this as a thing is a very good idea. It's not a service though. What is a service is going around to the mart, going up to farmers, saying, hello, would you fancy having your blood pressure tested? And that's what that is, a service, and then looping back into the GP. It's these sort of things you need it needs to be connected and better connected. This is, so I love this. So apologies to anybody who's had to sit through me talking about this before. So in the corner here, we have a small clip. It is a 3D printed clip. And so the origin of this is a designer who's a dedicated healthcare designer. He went into, this was in James's, went into the stroke ward, and at night on the stroke ward there are 2 nurses, but moving a patient requires 3 people. So what they would have to do is they would get a nurse from another ward who would come up, and then they would move it. And the reason was because of the pressure mattress. There was a cable attached to it which needed to be lifted carefully, etc. So what he did as part of a design process is he talked to all the people involved. He sat there and observed and looked at what was happening and properly identified a solution. And so this is a 3D printed for a 17-cent clip. It's got a magnet on the back of it. And then there's a spool thing here, which is quite magic in that you pull it, engineering concept I don't get, you pull it and it still works. But this basically eliminated the need for the 3rd nurse. to come in. So if you think of your process and your service and what you're doing, this again, the clip is a thing, it's a product, but it's about something that is integrated into a service in order to change the way things are working. These are my glimmers of hope. These are just good ideas. I love it. This is if you do squats in Russia, you get a train ticket. We're not thinking adequately, I think, in healthcare around the future and how do we actually keep people healthy and prevention agenda, but that's another talk. This is just a smart idea. I love this. This is down in Crosshaven, a wheelchair accessible picnic seat. And you can get there easily from the thing. And this kind of community, I just think this made me laugh. So among the glimmers of hope, a consultant rheumatologist who's based in Guy's decided to sit out in his waiting room in his OPD and talk to people, alien concept, to actually understand the situation. This is all people-based. This isn't about a magic computer saying something. It's about people-based. So he went out and spoke to them to understand what he could improve. And then this fed into a larger design project that he was working on. But sitting in the waiting room, interacting with patients, you get a very different feedback to a feedback form. So one of the things I think we're holding ourselves back, so we've no time to dedicate to anything, et cetera, yes. But what we're also doing at the moment in healthcare is we're stopping things, doctors are the gatekeepers, we're stopping things that we know are a good idea, but we can't back them because we don't have a very familiar randomized controlled trial. So for example, seatbelts are a good idea. Yes, that is. We all know that. It's changed the face of trauma medicine, etc. They're a good idea. So yes, we will at national level have policy for that. Is there a randomized controlled trial to say this is a good idea? On this corner, in this street, for the population of people who are passing, some of the stuff that we're stopping despite knowing it's a good plan. And I think there's kind of, like, it's obvious, it's a good idea, that we have to kind of engage with. This is how we think of patients and how we think of patient care. And that's because this is how we've been taught to think of patient care. And anybody who works in James's, the thing that isn't on this is the queue to get into OPD early in the afternoon that starts by 12 o'clock for the car park. These sort of things are the things that patients are experiencing, and we're not currently set up to figure out a way that we can create a patient experience that actually is beyond this. We meet people when they get to this stage. So when they become a patient is when we start to engage with them. And we engage with them in these places that are just grim. Sorry, that's a bit generic, but there's some nice places too, but a lot of them look like this. And this is how we segment ourselves. So you treat an organ, it's organ-based treatment, and that's what you do. And I would like if we could figure out how to move beyond this. So I'm not suggesting that we need to remove all specialties, but nobody on the receiving end of it is focused on the specific organ in the way that we treat. So I'm going to just kind of imagine a world. So this is the future state of how I see we could be, and this is all, enabling this would be about a design mindset with appropriate methodologies behind it, not just post-its on walls. And how we could use a design mindset across each of these 5 levels to integrate it fully. Because we all deliver care as a group of people. We don't do it as a set of boxes. We don't do it as a sheet that's a list on a wall. We do it as a group of people. This is the patient flow team in COH. And we want to keep people in this position where they're out and they're well and they're smiling. And we're not reaching out to them there. We're waiting instead till they come in and they're patients. I actually have had, I've been able to spend some time in Cork in the last few weeks, and I started swimming with a group of women in their 70s, 80s, and there's one 92-year-old. and they go in every day regardless. And they're all reporting symptoms of feeling much better. They do it because they feel better from it. There's a lot of people talking about arthritis and various things as well that they say is eased by swimming in the sea. Their experiences are totally removed from what we're treating them for or what we're engaging with them for. So we don't turn around and there's no doctor telling them, yes, that's a good idea. They'll report it and then they'll be told, well, if you feel well, keep going with it. But how do we keep people well and healthy, which we can do? We have the technology to do, but we need to set up the systems to do now. This is what I would like in a future world whereby all of this is possible now. So your personal preferences is combined with data and analytics about yourself that are given from systems, combined with behavioral sciences and understanding about behavioral insights and psychology and what moves people, population health, what are the prevailing health challenges in your area. You actually have to have access to services. And then there is the core medical information. Bringing this together in a personalized fashion is possible with technology now, but our systems aren't set up for it. Because I want to keep everybody healthy and well for as long as possible and to live as long as they can. Thank you very much for your time. I end... there's one last thing. The immortal words of the IKEA instruction manual. Things are better when you do it as a team. And I think that's a... Thank you.